to the deadly virus that has left the world helpless with its outbreak. Trying to make sense of a pandemic can be daunting, more so when it is in the middle of an infodemic. The 21-day lockdown of the entire nation is to ensure that people don't become active agents of transmission of the virus. By staying indoors and maintaining social distancing, prevention and disruption of the chain of transmission is achieved. We'll get you the latest updates on the measures taken by the respective state governments to ensure the threat of COVID-19 is minimized, along with international updates on the pandemic. This and lots more in the next 30 minutes. Let's get started. Total 873 confirmed cases of COVID-19 in the country. Active COVID-19 cases stand at 775. "78 people discharged after treatment for coronavirus. 19 succumbed to the disease." Prime Minister Modi interacts with radio jockeys through video conference, appeals to further strengthen awareness on important issues including social distancing. Home Ministry orders purchase of 10,000 ventilators and 30,000 more to be procured by BEL to ensure adequate availability of the machines. NET undergraduate and JEE main postponed till last week of May. Vice President M. Venkaiah Naidu donates a month's salary to Prime Minister's National Relief Fund. SBI passes on the entire 75 basis point repo rate cut to its borrowers. International coronavirus cases continue to spiral up with more than 5.5 lakh cases, killing nearly 24,900 people. Italy death rises by 919, highest daily tally since the start of outbreak. 345 deaths and 18,000 new cases in the last 24 hours in the United States. WHO appeals for protective gear for health workers. IMF says the world has entered recession. On popular demand during COVID-19 lockdown, famous serials Ramayana and Mahabharata make a comeback on Doordarshan from today. Ramayana to be shown on DD National, while Mahabharata to be shown on DD Bharati. And people post their photos watching Ramayana on social media. Ramayana trends on Twitter. Well, let's now take a look at this particular program in two halves. The first half where we look at India specific and then take a look at the rest of the world. The total active COVID-19 cases in the country has risen to 775. 78 people have been discharged after treatment, while the reported number of deaths stand at 19. Over 15,24,266 passengers have been screened at airports till now. As the nation combats coronavirus, the Health Ministry has assured that all possible efforts are being done to break the chain of coronavirus transmission. In his daily briefing to the media over COVID-19 pandemic, Joint Secretary of Health Ministry Love Agarwal said that the government is taking preventive and proactive approach to tackle the situation. In order to upgrade the number of ventilators in the country, Agarwal said the Health Ministry has given an order to PSU to provide 10,000 ventilators. Bharat Electronics Limited, or BEL, which is one of the Defence Ministry's PSUs, has been requested to purchase 30,000 additional ventilators in the next 2 months.
वेंटिलेटर्स की जो एक कमी स्टेट में कंट्री में महसूस की गई थी, उसके हिसाब से उसको अपग्रेड करने के लिए हमारे एक पीएसयू को हमने 10,000 वेंटिलेटर की आपूर्ति करने के लिए आदेश जारी किए हैं। इसके साथ ही भारत इलेक्ट्रॉनिक लिमिटेड से भी 1 से 2 महीने के अंतर्गत 30,000 एडिशनल वेंटिलेटर खरीदने का अनुरोध किया गया है। सरकार देश में वेंटिलेटर्स की उपलब्धता बढ़ाने के लिए सभी रिक्वायर्ड कार्य कर रही है।
Meanwhile, informing the media about telemedicine, an initiative by the health sector to cater to patients in the absence of outpatient service at the hospitals, Agarwal said that the Health Ministry has issued national telemedicine guidelines. It is a facility through which a patient can consult the doctor sitting at home. He further said that at least 1.4 lakh companies have allowed their employees to work from home.
25 मार्च को टेलीमेडिसिन के लिए भी दिशा निर्देश जारी किए गए हैं। ये दिशा निर्देश और इनके द्वारा लॉकडाउन की अवधि में स्वास्थ्य सेवा का डिसेमिनेशन, अवेलेबिलिटी बढ़ाने के लिए इसके लिए डायरेक्शन इशू की गई हैं। माननीय राष्ट्रपति जी ने भी आज देश के सभी गवर्नरों, लेफ्टिनेंट गवर्नरों और साथ ही जो नॉन गवर्नमेंटल ऑर्गेनाइजेशंस हैं, जिसमें कि भारतीय रेड क्रॉस सोसाइटी भी है, उनके साथ भी वीडियो कॉन्फ्रेंस के माध्यम से कोविड-19 के ऊपर उसको कंट्रोल करने के ऊपर और उसके साथ उसमें कैसे मिलकर हमें काम करना है, उसके लिए भी एक आज वीडियो कॉन्फ्रेंस की थी।
Well, for more on this story there on Ground Zero, Tapas Bhattacharya joining us this morning. Tapas, good morning. Firstly, Tapas, tell us there the situation on Ground Zero and how it is and how are people, there on the streets maintaining social distancing?
Yeah, well, absolutely, and it is high time that everybody maintains social distancing. And right now, I'm in East Delhi, where if you can see that there are some of the shops which are open. I can show you some of the shops which are open and selling the basic necessities, with kirana shops, as well as this, medical shop which are open there. And as you can see, that there are marks have been made, if you can see, and people are using these marks to maintain social distancing. That is, which is very important. And you can see this is what they have been told to do. So these marks have been made specifically to ensure that nobody comes too close to each other even while buying the essential items. So that is the basic idea. And there are people also here, taking necessary precautions. But even after that, we feel that there are some people who are actually coming, and you can just see this lady's coming. She doesn't have a mask, and there are people like her who are tend to walk in the street. There are people who are now telling them that please wear the mask, and please make sure that you do not go out, and you do not put yourself not just in danger, but also put the others also in danger. So in terms of that, people are sanitizing each other, the basic necessities that have been taken care. When you talk about the essential items, when I spoke to the shop owners regarding the fact that whether or not they are having enough essential items in their shops to provide, let's just say, rice, lentils, and other stuff to the people who are coming here, they say that they have to go to the main mandi to buy all those basic stuff. Earlier, there used to be distributors who used to come to their doorstep and provide them. That is not happening. So in that sense, they are hindered, and the stocks are depleting fast. Even in mandi, we've been told that some of the things like, for instance, the oil, the cooking oil, the lentils and the dals basically are running short of supply. So they have been getting very less of that. So keeping those things in mind, one has to say that, we should not do the bulk buying. That is, a lot of people are doing the panic buying, which has been done in here. So that is something that the people needs to refrain from doing. And that is what is the need of the hour. People are coming here. It's not that they're not coming out of their home. They're coming, but it's not in bulk, in numbers that we usually see. They're coming in a short, what you call shorter number. The people are coming in a way that they only come out of their housing societies only to get the basic necessities. Anil.
Okay, but Tapas, since you mentioned that, you mentioned about that lady, is there an availability? Because in the last 2-3 days, the medical shop seems to be somewhere saying that there is no availability of masks, that is available there for sale. Having said that, do you see when you are there on ground zero, do you see, is there a shortage of masks that are available for people to buy? That's the reason people are not able to wear it, you know.
That is one point, you know, that Anil, that's a very valid point, that there's definitely a shortage of masks even for people like me. When we go out for reporting, we have to find a mask from where we get the mask. But you know, apart from that, you know, there are people who think that even if you do not have a, you know, let's say N95 masks, you can cover yourself, you know, you can cover yourself in a better manner. You can cover yourself in a scarf, or you can cover yourself in a what you call a handkerchief. There are what you call, there are masks which are which can easily be made through you know, clothes, and which you use and you wash them, and you can reuse them. The N95 masks and other masks like this, the surgical masks, you cannot reuse them. So that is one hindrance of that. So if you are using you know, the masks made of clothes, you can reuse them. So it is the need of the hour that people you know, understand this, that they need to get a hold of it. And even if you don't get the mask in the chemist shop in other places, you can actually make a mask of your own. Let's just say, for instance, if a lady is going out, she can always use those dupattas and make it as a mask. Anil.
Okay, you know, having said that, you know, how do you see the ground situation there when it comes to, you know, police patrol? You know, there are passes that have been issued for people to move out, you know, for other things. So how do you see there on the ground zero? How are, you know, are police finding it tough to manage the situation there, especially when you see, you know, people and excuses that are coming up for people to get these passes? You know, if you look at the cases that have come up, you know, you will see some kind of surprising calls for passes, especially to get people to take their dogs out for a walk, for getting, you know, pedicure and manicure is done. So these kind of requests are coming. So how are police managing it there on ground zero, asking people to stay indoors and maintaining social distance?
You know, you're bang on there. You know, this is an elite syndrome that we have. You know, we will not do anything. Our maid has to do everything. Our servant has to do everything. So that's an elite syndrome that is there. And but before Anil, I answer that, I would like to show you an example of these people who are, if you can just see, they are taking, they have those what you call cartwheels where they have the pyaz, the alus, and all the, you know, vegetables that one needs, and they will sell it outside. So now coming back to your point, Anil, let's just say that it's a thing that police has been grappling with, especially places where it's what you call there is a elite domination, if I may use the term. Places where there's a societies where the people do not understand the concept of doing their own work. But even in societies, and where I am living in East Delhi, they have absolutely shut themselves off. They have quarantined themselves. So that is one good thing. They have shut themselves.
Okay, thank you, Tapas, for giving us those inputs there. Very much, you know, a ground report there on what exactly is happening. You saw people there maintaining social distancing, people not coming out in large numbers, people just looking at buying their basic amenities there to take, you know, they're living on a day-to-day basis. Remember, do not pile up things in your house. There are a lot of people who are still looking for the basics, just like Tapas mentioned about people still looking for a lot of shortages there when it comes to the Kirana stores. So please don't stock up things. Take things as and you know, how much is required. Keep that quantity in check when you go out to buy. Well, moving ahead, as the number of cases of COVID-19 are mounting each day in India, with the present tally at 775 and the death toll reaching 19, Ministry of Health and Family Welfare has tweeted to share the self-observatory symptoms to know whether you are infected after coming into contact with the coronavirus patient or not. The ministry said self-monitoring of cough, fever and difficulty in breathing for at least 28 days is necessary. Meanwhile, the National Medical Entrance Exams (NEET) have been postponed in view of the countrywide lockdown due to the coronavirus outbreak. In a tweet, the HRD minister said since parents and students have to travel to different examination centers to avoid any inconvenience to them, he has directed the National Testing Agency to postpone the NEET exams. That's the undergraduate for this particular year, and also the JEE mains that are going to take place These exams are postponed till the last week of May. The national eligibility cum entrance that was scheduled for May 3rd, that's also been postponed, and the Union HRD Minister has also directed all Kendra Vidyalayas Sangatans to provide their buildings to local administration for temporary housing of suspected COVID-19 patients in accordance with the competent authority. KVS has directed that on receipt of a formal request from any defense authority or district administration, the principal of the Kendriya Vidyalaya concerned shall allow the use of classrooms to KV school buildings for temporarily housing the suspected COVID-19 cases. Vice President M. Venkaiah Naidu contributed a sum equivalent to a month's salary to the Prime Minister's National Relief Fund to strengthen the government's efforts in combating COVID-19 outbreak in the country. In a letter to the Prime Minister, the Vice President described COVID-19 as a calamity of extremely severe nature, which has claimed a heavy toll of life across the globe. He said India is fighting the pandemic by taking timely and emergent measures from time to time under the leadership of Prime Minister Modi. Union Ministers Ravi Shankar Prasad and Ramesh Pokhriyal Nishank have also donated their 1 month salaries to the Prime Minister's Relief Fund. State Bank of India has said that it has decided to pass on the entire 75 basis points repo rate cut announced by the Reserve Bank of India to their customers. The new rates to be effective from the 1st of April will be applicable for its borrowers availing loans based on external benchmark linked lending rate and repo lending rate. The bank said in a statement that the equated monthly installments of eligible home loan accounts linked to EBR or RLLR will get cheaper by around 52 rupees per 1 lakh rupee on a 30-year loan. Union Finance Minister Nirmala Sitharaman has appreciated the service Bank Mitra or banking correspondents are undertaking across the country. In a tweet, she said that she will talk to the states requesting no restrictions in their movements. She will also speak to all banks to help the cash flow, ensuring timely access to all. The minister also tweeted that the Secretary Corporate Affairs has held discussions with CII, FICCI, ASSOCHAM and PhD Chambers of Commerce to hear and address their concerns. She said that she will continuously remain and respond to industry's inputs. Moving on, big news coming in from Power Minister R.K. Singh. The minister has said that the government is committed to provide 24/7 supply of electricity to all consumers. He added that during the present emergency, there will be no curtailment of supply to any DISCOMs, and so DISCOMs would be given 3 months moratorium for payment of dues. So this is a big development that's coming there. The DISCOMs will be given a 3 months moratorium for the payment of dues, and there will be no power cuts, and you will be getting 24/7 power supply. Well, Ajay Mishra, our correspondent, now joining us. Ajay, good morning. Ajay, give us a sense there on ground zero, the area that you reside. How are the things there? Are people maintaining social distancing? And that's not all. Are children staying indoors?
Absolutely. I think the life out here in Delhi for Ankur Vihar, Ghaziabad is quite normal. Anil, people are coming out in very few numbers to buy their daily essentials like milk and vegetables and fruits for their daily puja. Things are quite normal, but we are tracking the other macroeconomic initiatives taken by the government all across the country, and it's pleasant to share with you that today the Power Minister also took stock of the state of the power sector in the country, and he has issued some very important directions for the state DISCOMs and also to the central electricity regulator. He has requested them that as the consumers are not able to pay their dues to the DISCOMs. DISCOMs are feeling financial crunch at this point in time. So distribution companies all across the state should not be compelled to actually make payments to the production companies. So Power Minister have assured that all the stakeholders of the power sector are working 24/7 at this point in time to ensure the supply of electricity to every stakeholder into the economy. We know that every village has been connected with the electricity supply. Now every home has been connected to the electricity supply, and our focus is on the 24/7 access to the power. And that's what, in order to ensure that the 3 months moratorium has been given to all the DISCOMs, because it is the distribution companies which actually make supplies to the various consumers. So now there will be no burden on them for 3 months, and we expect that the electricity supply to all the stakeholders, be it consumers, all the essential industry workers who are actually working in production of some of the essential commodities will be ensured, and government is trying its best to keep the electricity supply smooth in every part of the corner.
Ajay, since you also mentioned that particular, we read about a story about SBI passing on that 75 basis points benefit entirely to the customers. Have the private banks too jumped in to pass on all these benefits to the customers? And what happens to those people who have got an automatic transfer of their loans that they have taken with the banks? What happens to them? How is a stopgap arrangement or this particular announcement by the RBI governor benefiting those people?
So point number one, the private sector will follow suit the public sector banks, because it's a competitive market, and if they're not going to follow the norms, the market will reject them. The consumers will not like them to do so. So there will be pressure on the private sector banks, and we know that they are working on the modalities. Their ELCO, the asset liability committees, are actually meeting today to take a stock of the current situation, and also how to pass on the benefits and how much of the benefit can be passed on to the consumers who has taken retail loans. That is being worked out, and we are sure that all the public sector and private sector bank will come out to help their customers in this very never before kind of situation, and an emergency kind of situation. Point number two, if you're asking me that what will happen to the EMIs of the retail customers, we know that the EMIs will be stopped by the banks for 3 months, and your duration of the EMI will be enhanced by another 3 months. So if your loan period is due for say 2 years, it will be now due for 2 years and 3 months. But for the next 3 months, the automatic deduction of the EMIs from the bank accounts will not happen. That's what the RBI has suggested, and I think the banks are going to follow suit.
Okay, one quick word before I let you go. This is also Navratra time. How do you see subdued celebrations there? People don't come out. You generally have ladies coming out and celebrating it there in societies. How is the subdued celebration this time around, especially in the place where you live?
I think people have understood that this is a time for inner re-engineering, Anil, and everybody is worshipping in their respective homes. The shops are open for essential commodities like fruits and items for puja. The shops are open for a few hours during the evening and few hours in the morning. So, and there is no dearth of supply of milk and milk products in the area. So people are quite comfortable. They're actually doing kirtan and bhajan in their respective homes and worshipping their god and goddesses. And I can see the sounds of shankha and some kirtan and bhajan from the surroundings. So people are quite happy, and they are making best use of this this time to actually go for inner soul of the search, soul searching, and do the best and find out the best, and emerge out as a better person when the lockdown ends.
Ajay, thank you for those updates there. They're staying there at your place, but then giving us updates on what's happening there in Ghaziabad. Thank you, and appreciate you joining us this morning on tracking COVID-19. Well, moving ahead and moving focus on police in various states emerging as masihas and people amid lockdown. Besides maintaining law and order during the lockdown period of 21 days, Delhi police is also taking care of poor stuck far away from their homes. On Delhi Police's appeal, locals have pitched in together to arrange food for such needy people. In such a situation, these efforts both by the police and locals is really commendable. Well, good work is also being done by Uttar Pradesh Police to help the poor and migrant workers. Uttar Pradesh Police has provided water, food, medicines and essential items, and at the same time raised the awareness among people to maintain social distancing. Some other officials were also seen feeding stray dogs. The mythological epic Ramanand Sagar's iconic Ramayana once again entertained and enlightened people across the country who are at home due to the coronavirus 21-day lockdown. Ramayana was first premiered on Doordarshan in 1987, after which, as they say, Indian television wasn't quite the same. The Ramayana revival is also a reminder of the good old days when family members and prying neighbors would gather around the television for their weekend fix. It was a daily ritual more than a mere classic. With the decision, government aims to create the same magic again, ensuring people stick to their homes more and more. Besides Ramayana, Mahabharat will also be telecast on Doordarshan and DD Bharati. While one episode of Ramayana is in the morning at 9 a.m. to 10, another one will be on prime time from 9 p.m. to 10 p.m. on DD National. Mahabharat will be telecast at 12 noon and 7 p.m. every day on DD Bharati. Meanwhile, Information and Broadcasting Minister Prakash Javadekar also watched Ramayana at his residence. People also posted their photographs watching Ramayana on social media. Ramayana was trending on Twitter. Remember, a special edition titled COVID-19 Doctors Speak will be on DD News from 2 p.m. onwards. It will be for 60 minutes. You can call with your queries and a panel of doctors will provide solutions or answers about COVID-19 and how to keep it at bay. The toll-free numbers 1-800-11-1234. I'll repeat the number again, 1800 11 12 34. Do not forget to call at between 2 and 3 p.m. You will get to raise your questions and the panel of doctors will answer them. Well, time for me to say goodbye, but remember, stay indoors, stay safe, stay happy. Bye-bye.